Hi, I am Dr. Jade. I go by Dr. Jade Norris, but I go by Dr. Jade. I am in Las Vegas. I opened my practice in my hometown, and our practice is Inspire Primary Care. We serve busy professionals that are looking for high quality primary care and to transition to a healthier weight. I am specialized or subspecialized in preventive and lifestyle medicine and obesity medicine, and I love to help my patients transition to a healthier lifestyle. I did not know about DPC when I entered residency. I always had an entrepreneur mindset. I knew that I dreamed of having my own practice after residency, but I didn't know how that would be possible with an insurance based practice. However, it was just a side conversation with one of my attendings during my second year of residency. She was just asking me, what do you want to do after you're done with training? What are you interested in? And I was just kind of explaining the lifestyle I wanted, the way I wanted to treat patients, how I wanted to spend lots of time with them and kind of be the community doctor, help to, not be rushed in and out in 10-minute visits and really help them to reverse chronic disease. And she said, it sounds like you're interested in something like direct primary care. And I had never heard of it. I was super excited about just the idea of being able to open my own practice in the way I envisioned. And that led me to just learning all things DPC and going to the national conference, listening to the My DPC Story podcast, reading the books that are on Amazon for direct primary care, and following different direct primary care physicians that specifically open their practice straight from residency. And it was set in my mind from there. After doing a lot of learning during residency, I mean, one of the blessings of the pandemic was that the national conferences were all virtual those years that I was in residency. So I was able to, be on night shift and attend the DPC conferences while I was a resident. So my first step was really learning. And because I was in residency, I had the luxury of, in between busy shifts, on night shifts, really just learning all that I could about DPC, specifically the podcast, the books, going on Instagram, following the different physicians that are DPC doctors and looking at their journey. There's so many doctors sharing their journey and tips on DPC, joining the private Facebook groups, the Direct Primary Care Docs Facebook group, the DPC Women Facebook group, and learning from other physicians, asking questions, being a sponge. A few DPC doctors also hosted masterminds at their practices. And so I went specifically to Detroit with Dr. Paul Thomas and learned from him at his practice. He opened straight from residency. So it was really important for me to learn from those who were going to be in similar shoes as I, doing this straight from residency. And I kind of took all of that and figured out what worked for me and my family. And I went from there, figured out how much I needed to save, figured out what kind of side job I needed to have, which for me was urgent care while the practice grew, and kind of strategized from there how to open this debt free, which I'm super excited. We opened this with no loans. I saved a very small amount during residency, was able to open low overhead, and it's been amazing. I actually have my very last urgent care shift at the end of this month, which is crazy to even think about. When I first built out my strategy, my plan, my business plan, we anticipated that me and my husband, we anticipated I would need to do urgent care for about 2 years. And thankfully, it's been a year and a half, a year and like 4 months, and I'm able to quit at the end of this month. So it's a super exciting time. I love the lifestyle that it one allows me and my family to have. So I opened my practice. I had my first baby while I was an intern in residency, and then I had my second baby right after residency. So I opened my practice when my baby was 2 months old, which was crazy. Like I think back and I'm like, how did this all happen? But I did, and I was able to figure out how I could be the best mom, wife, and doctor, and this practice is what was the best combination for me and my family. So it's great because I'm able to have the freedom to choose my schedule. I can work virtually, I can work anywhere, and I'm really able to help my patients prevent and reverse chronic disease in an unrushed way. And I don't have the hassles of the insurance company billing in the picture. And it's just me and what I imagine the old school doctor physician relationship was like. So I feel like it's better quality of life for me as the physician and a better quality of care for the patients, which is a win-win. And so when I first started, I had what I call my starter price point, and that I would have needed to continue doing urgent care for much longer if I had kept things there. And so there's a big debate in the DPC community. Do you raise prices? Do you not raise prices? I did. After my first 50 members, I raised to what I call the right fit pricing. And so I raised my prices. That was a big help. And then I realized that a huge component of what was attracting my patients was the health transformation, specifically through medical weight loss. And originally it was included for our members. They were having huge wins, reversing their chronic disease, losing 50, 60 pounds plus. All their friends were coming in and wanting the same thing. So we made a new vertical in the practice where people could upgrade to our medical weight loss component. And that also really made it where I was able to quit urgent care much sooner, because that became very, very popular. So primary care is all of my patients are primary care members, and they can upgrade to medical weight loss. And I would say about 30% of my practice includes medical weight loss at this point. So when I first opened the practice, I did not know that I would basically become a specialist in medical weight loss and obesity medicine. I got the additional CME training in obesity medicine based on the needs and desires of my patient. Almost every patient that joined my practice, their concern was their weight. Their concern was, they wanted to transition to a healthier weight so that they could transition down and off of medications. And that became my niche. And as I was getting those wins for my members and I loved it so much, it just all merged into what became a subspecialty of mine. And so I would say that for people to really be open, because when I first opened my practice, I thought maybe I was interested in aesthetics and maybe I'd want to add like Botox and fillers and those type of things. And I quickly realized that that wasn't where my passions lied. And so I didn't add those things, but I didn't know exactly from day one that I would lead into weight loss being a huge part of what I do. And so I was just open to what my patients needed and what merged with what I really love to do. And so that's how it grew. I would say look for mentors and join different social media families, join the Facebook groups, go to the national conferences if you can. Specifically, the DPC Summit is every summer. And so the DPC Summit, joining the private Facebook groups and having mentors, and just literally by joining Instagram and learning from them. Join my Instagram. I'm at Dr. Jade MD and at Inspire Primary Care. People always DM me, ask me questions, and that's really how you learn. We learn from each other. It's a really giving community that wants to see others win, especially residents that are interested in this. And also don't think that you have to start your own practice. It's a really exciting time in DPC where if you want to start your own practice, we've got the build out and the knowledge and the pearls for that to be successful. But if you want to join a practice, that's also a huge option now, because there are so many established practices now looking to hire specifically residents, right, who are fresh from their careers. So yeah, be open. It's a great field, and it has been incredible for me and my family. I'm so thankful that I've learned about DPC.